Hi, I'm Dr. David Hill, and today we're going to talk about migraine treatment for kids. Now, people used to think migraine headaches were an adult disease. Children don't get them. However, we have some new imaging technologies to look at the brain and see the activity that's associated with migraine headaches. And we have new categories of drugs that specifically help migraines and don't help other kinds of headaches. And through both of these modalities, we've learned that migraines not only do occur in children, but are quite common in children. In fact, we now think that migraines can occur in infants as young as 6 months of age. We also understand migraines better. They're caused by problems in channels within the nerve cells of the brain that allow certain chemicals like calcium, sodium, or potassium to cross into those cells in ways that may be abnormal. So, things to know. Your child's recurrent severe headaches are almost certainly not sinus headaches. Children don't tend to get headaches when they get sinus infections, but they do get lots of migraines. Likewise, there's nothing wrong with taking your child to the eye doctor to see if his vision is good, but usually these chronic recurrent headaches are not due to a visual problem. So certainly, go by the optometrist or the ophthalmologist, get your child's vision checked, but know that in most cases, glasses are not the answer to chronic recurrent headaches. That said, we have a lot of answers that work really well. After a thorough history and neurologic exam, if your doctor is confident that your child does have migraine headaches, he may recommend something as simple as Tylenol or ibuprofen to help relieve the symptoms. He or she will also probably advise you not to use any pain reliever more than about 2 times a week for migraine headaches. Using pain relievers more commonly than that can lead, ironically enough, to rebound headaches. Those are headaches that come when the pain reliever wears off. So you want to be sure whatever you're doing as a pain reliever, twice a week, no more. Now, there are migraine-specific medicines, probably the best known as sumatriptan or Imitrex, but there's now a whole bunch of drugs in that category and a lot of ways to give them. If your child can't swallow a pill, there are nasal sprays, there are dissolving tablets, and there are injections of these medicines as well. If you're using one of these medications, remember not to treat the weird feeling that may precede the migraine. You don't want to give the medicine then, but you do want to give the medicine as soon as the pain starts. Even with these medicines, remember, twice a week, no more, so you don't get the rebound headaches. In children who get frequent recurrent migraines and are needing medication more than once or twice a week for them, there are also preventive medications. These come in a whole variety. Some people use an anticonvulsant called Topamax. Some people use a beta blocker like Inderol. Other people use an old antidepressant like amitriptyline. So there are several different types of medications that can work. However, we really think that very few people need to suffer from migraine headaches. There are so many things we can do to make them better. So, talking about treating the symptoms of migraine headache in children, I'm Dr. David Hill.